Hello, I'm Dr. Paula Clayton. I'm a retired professor of psychiatry from the University of Minnesota and the University of New Mexico. I want to talk about suicide first, just because I think we don't really know how common it is. The last time they took figures that in 2013, there were 41,000 suicidal deaths in the United States. It used to be the 11th leading cause of death. Now it's the 10th leading cause of death. And it used to be that deaths from breast cancer were higher, but now it turns out breast cancer deaths affect 38,000 people. So there are more deaths from suicide than, say, breast cancer. And it's 3 to 4 times more common in men than in women. And it goes across all age groups, but the most common age group is between 36 and 64. So it used to be that the elderly had the highest suicide rate, but now the suicide rate is more common in middle-aged men and women. It's important to know this, to think about how to prevent this. And so I'd like to then talk about sort of the treatments we know about for suicidal attempters. So the only approved treatment for the prevention of suicide attempts or suicidal thoughts and actions is clozapine. And it was proven in a very large study and was approved by the FDA. And since that time, it turns out that in Finland, where they follow people till their deaths, that the schizophrenics who were on olanzapine had fewer suicides than any other drug that they've been treated with. So, but there are other drugs that are certainly promising. A recent review on lithium showed that given for extended times. It also is helpful both in depressed patients only and in bipolar patients with depression. So it should be a drug that's considered for the treatment of suicide attempters. And finally, you probably all know that ketamine, which is an anesthetic sometimes for children, is being tested for suicidal in patients who are suicidal. And it's interesting because it's actually it has to be given IV, and you have to be in the hospital to be treated that way. And they give it over 40 minutes, and then they test you in the next 4 hours to 24 hours to see if your suicidal thoughts have improved. And it's promising that they have. Now, the most interesting thing is that a company has devised a nasal spray called S-ketamine, and they're testing it. And hopefully, it will be on the market in the next 12 to 18 months. And what you do then is you take this nasal spray and you use it twice a week for 4 weeks while your antidepressant is building up in your blood. So it's really for the treatment-resistant depressives or the suicidal depressives given in the interim until you get an adequate amount of an antidepressant. Now, there is another kind of suicidal action that's under review in DSM-5, and it's called non-suicidal self-injury, or NSSI. And those are the young people, most boys and girls, who either cut themselves where they can on their forearm or their legs repeatedly, or they burn themselves. Somehow they use this as a way to relieve tension or disappointment, or as a way to sort of treat some kind of conflict, and most of them do it repeatedly. And it turns out if you do it repeatedly, it's much more serious. And that kind of disease or disorder may lead to people making suicide attempts and dying by suicide. So they're more likely than just the young person who does neither of those things. And unfortunately, Because we've never singled it out, we don't really have any pharmaceutical treatments for it. There are some psychotherapies that have been proven to be helpful, but it's just beginning to unfold the research in this area. And they've used all sorts of drugs to try to treat it. And the only ones that seem promising are naltrexone, which is used for addiction, so kind of repeated behaviors, and then atypical antipsychotics like aripiprazole and ziprasidone. So that new category is one you have to be familiar with to single it out because it is potentially a disorder that can lead to suicide.